Hello, my name is Dr. Sean Walsh, and I am the CSO of Radiomics. It is a pleasure to present to you our research on oncological biomarkers from radiomics analysis of standard of care CT images. We begin with the topic of biomarkers in oncology and the potential role of imaging in this space. Biomarkers have many potential applications in oncology, including risk assessment, screening, differential diagnosis, determination of prognosis, prediction of treatment response, and monitoring of progression of disease. Because of the critical role that biomarkers play at all stages of disease, it is important that they undergo rigorous evaluation, including technical validation, clinical validation, and assessment of clinical utility, prior to incorporation into routine clinical care. Here, we present two examples of how imaging, and more precisely radiomics, can potentially play a role in the care of cancer patients. So what is radiomics? Radiomics is a workflow to obtain a quantitative biomarker measurement from medical imaging in a repeatable, reliable, and relevant manner to support decision making. The process begins with image acquisition, the segmentation of a region of interest, manual or automatic, the extraction of features, handcrafted or deep, and then learning the link with the endpoint of interest, e.g., clinical outcome or a biological status. In the case of HPV, we trained and validated a radiomic signature to determine HPV status in a large, multicentric dataset of oropharyngeal squamous cell carcinoma. The signature performed strongly with an AUC of 0.76 when compared to the binary classification of P16 immunohistochemistry. In contrast, the radiomic signature predicts a score along distribution, i.e. the HPV-ness of the tumor, upon which a threshold can be applied to produce a binary classification of HPV status. Critically, when the radiomic signature is compared to the binary classification of P16 immunohistochemistry with respect to the clinical outcome, the Kaplan-Meier curves are statistically indistinguishable over a very large follow-up time, 10 years. This raises the question as to whether the radiomic signature is a legitimate alternative to the conventional biopsy approach, at least in the context of OPSCC. If we explore more broadly, in general, HPV is thought to be responsible for more than 90% of anal cancers and about 70% of vulvar cancers, a similar prevalence as found in OPSCC. To evaluate the potential pan-cancer generalizability of this radiomic signature, an exploratory validation was conducted, yielding promising results, as the radiomic signature appears equally performant in the context of anal and vulvar cancers as OPSCC. Switching our attention to the case of EGFR, we trained and cross-validated a radiomic signature to determine EGFR status in a small multicentric dataset of non-small cell lung cancer. The signature performs moderately with an AUC of 0.67 when compared to the binary classification from genetic sequencing. When compared with the literature, this result is not remarkable. However, the key point here is to show that crucial yes-no exploratory decisions with respect to signature discovery in a small dataset is feasible. In order to deliver clinically relevant performance, high-quality data is essential. In this particular dataset, there was reasonable consistency with respect to imaging parameters such as slice thickness. However, parameters such as KVP, MAS, reconstruction kernels, field of view, these all suffered from reasonable variation, and thus the performance was detrimental. To conclude, based upon this analysis and these results, it is clear that radiomic analysis of baseline medical images has been proven capable of identifying oncological biomarkers such as HPV and EGFR. This can be an alternative to a conventional tissue biopsy. Radiomics biomarkers identification offer a path to reduce the cost of diagnosis, as it can be potentially used as a first screening tool, along with clinical covariates of interest. Prioritization could be given to certain or uncertain cases that require conventional profiling. This would reduce time, the resources required, and hence the costs. Although further validations are needed with more extensive data sets, radiomic analysis clearly has a potential role to play in the classification of several oncological biomarkers. And data quality is a key driver of radiomic signature performance. These are initial results with a high degree of pedigree that we look forward to building upon in the future and engaging with the community to drive value and bring personalized precision medicine via imaging and radiomics to the clinic. We thank you for your attention.